So we performed a study. We wanted to look at, hey, how does ASEA affect the allostatic load that people are under? How does it affect their ability from a systemic standpoint to be resilient to the stressors that we're exposed to due to the megatrends that we've been talking about at ASEA for a very long time, thanks to Vertus and Tyler. So Aspen Labs started as a safety study. What we found was they had some capabilities beyond just conducting a safety study, and so we decided, hey, this allostatic concept is important, let's test some markers. So a little bit about this study. There were 30 human participants, ages 21 to 55. They had to be healthy, meaning no pre-existing conditions, and they were going to take the product for 16 weeks, and we were going to study safety and resilience. When I talk about safety, you guys have heard me talk about, hey, ASEA is 100% non-toxic, 100% non-mutagenic. Those are two of the outcomes that come from safety studies. There are some more safety studies that you look at. You look at a variety of biomarkers, and there are healthy ranges established by governing bodies around the world. And what you do is you say, hey, did ASEA push people out of a healthy range? If not, it's considered safe. And so those are one category that we looked at during this study, and the other concept was resilience, or this ability to address allostatic load. So some really interesting results here. IL-1 beta, interleukin-1 beta, IL-6, these are cytokines that are largely considered to be representative of overall stress and oxidative stress in the body. And then underneath that we have total glutathione, meaning free glutathione in the body. Now, we've been talking about NRF2 for the last 2 years or so. Everybody here is very well acquainted with NRF2 and how NRF2 stimulates the production of glutathione, which is a protective protein, acts like a bodyguard for your cells, right? So we wanted to track that as well. And here's what we found. From a baseline to 60 days, you see a 16.6% decrease in IL-1 and a 2.6% decrease in IL-6. Conversely, you see an increase in glutathione. Now that should make some sense, right? What does glutathione do in the body? Combats oxidative stress, right? And IL-1 and IL-6 are markers that indicate the level of oxidative stress. So that makes lots of sense. What's amazing is what happens in the next 60 days. 86.8% decrease in IL-1 beta. Now, IL-1 beta is widely regarded as a systemic indicator of inflammation and oxidative stress. You see an 87% reduction in systemic oxidative stress. I want to make sure that you guys are getting this. Oxidative stress at a systemic level decreases 87% in human trials. Now here's what's interesting. While IL-1 is more broad in its indication of inflammation, IL-6, while being related to overall inflammation and oxidative stress, is also tied to cardiovascular oxidative stress. In fact, patients who, after COVID, experience myocarditis, one of the indicators of myocarditis is an elevated level of IL-6. And so a decrease of 9.6% in IL-6 markers is a significant result for people who are looking to address cardiovascular health. Now, what's interesting here is glutathione. What happened in the next 60-day period? It decreased relative to the initial increase, right? It increases, but it increases less. But the decrease in IL-1 beta and IL-6 was massive. So what happened here? I have had many questions over the last 6 months about health challenges where physicians would recommend decreasing glutathione in the body. Okay? You guys are tracking, I see smiles. There is a difference between endogenous formation of glutathione and exogenous supplementation, meaning glutathione that's made within the body and glutathione that is either injected or taken in oral supplementation form. What happens when you supplement glutathione? The body has to use it. It's there, it has to be used. But when you stimulate production of endogenous glutathione, there is a auto-modulation that happens, or an auto-adjust that happens. So while glutathione was high in the initial 60 days, as oxidative stress and inflammation decreases, the need for glutathione does what? Goes down. And so less is produced. I'm seeing light bulbs go off for a lot of you that have asked me this question about patients that need to suppress their glutathione. So we see an automodulation. Let me give you a tip. The only time you can get automodulation of glutathione is when it is endogenously formed. The only way that you can get endogenous glutathione is through a bioidentical signal within the mitochondria of the cell, which is redox signaling molecules, right? Okay, thanks.